Welcome to PSY 318, Child Psychopathology, Study Session 1, Classification and Diagnosis of Childhood Disorders. Introduction. This lecture introduces you to the general classification and diagnosis of childhood disorders. Highlights include the classification and diagnosis of childhood disorders listed in DSM-4. Also included are discussions on the diagnosis of childhood disorders, which center mostly on the importance of maturational change and experience. Childhood disorders, also contained in DSM-4, are presented graphically to facilitate better understanding on the part of the students. Objectives. At the end of this lecture, you should be able to 1. Classify childhood disorders. 2. Identify various types of childhood disorders. And 3. Mention the factors responsible for abnormal child development. Pretest. 1. Classify childhood disorders. 2. Mention the 4 areas of childhood disorders. 3. Mention the factors responsible for childhood disorders. Content. All the childhood disorders listed in DSM-4 involve behaviors in which a child deviates from what is expected of her at a particular age and cultural setting. In addition, these behaviors are persistent and severe, and they interfere with the child's development and day-to-day functioning. First, in order for a behavioral or psychological problem to be considered a disorder, the child must either be suffering or the child's behavior must be making others to suffer. What distinguishes a childhood disorder from normal variation in development is often only a matter of degree. In other words, there is a quantitative rather than a qualitative difference between abnormal and normal behaviors. Minor versions of this problem behaviors can be found in well-adjusted children. For example, the occasional temper tantrums that occur in many preschoolers would hardly be labeled psychological disorder, but frequent tantrums that occur in peculiar circumstances or for a long period of time might be considered abnormal. The child's developmental stage is also important. Some of the most severe mental disorders, such as bipolar disorder, major depressive disorder, and schizophrenia, do not appear in the table 8.1. It is uncommon for children to show signs of these disorders, but when they do, the adult diagnostic criteria are used. Many children meet criteria for more than one of the diagnoses listed in Table 1. This is referred to as comorbidity, meaning multiple diagnoses. It is especially common for depression to co-occur with other disorders in children, particularly with conduct disorder and anxiety disorder. Researchers do not know why syndromes tend to occur together. One possible explanation is that there is a causal relationship. In other words, having a disorder like depression may cause the child to seek attention by violating rules. On the whole, children's problem can be divided into 4 areas: emotional disorder, developmental disorders, eating and habit disorders, and disruptive behavior disorders. A discussion of the diagnosis of childhood disorders centers mostly on the importance of maturational change and experience. The normal course of human development involves constant change, and the child's behavioral capacities and propensities are always evolving memory and concentration. Impulse control improves dramatically throughout childhood and during the teenage years. Abstract reasoning abilities begin to approach adult levels. Abnormal child development, like normal child development, is the result of many factors. Vulnerability to some disorders is present at birth and may be consequence of genetic factors or prenatal complications. An example of disorder that is influenced by genetic factors and prenatal complications is schizophrenia, a mental illness that involves abnormalities in clarity of thought and communication. Usually, the early signs of childhood disorders are recognized by parents, primary care physicians, or the child's teacher. The outset of a mental disorder is tragic at any age, but it is especially so when it occurs in childhood. People often think of the childhood as a carefree and happy time, yet it can also be frightening and upsetting. Children of all cultures typically experience at least some emotional and behavioral problems as they encounter new people and situations. When the course of the development is interrupted by psychological problems, the child is often deprived of experiences that are important for psychological growth. When diagnosing children, a psychologist must differentiate normal variability in rates of development from psychological problems that indicate a need for treatment. A unique aspect of childhood problems is that normal psychological development proceeds at different rates for different children. As a result, it can be difficult to distinguish a genuine psychological problem, one that requires professional attention, from a problem that simply reflects the child's current developmental stage. A second unique aspect of the childhood psychological problem is that they are less predictable than adult disorders. Children often change dramatically over a relatively short period of time, so that it is difficult to predict which children are vulnerable to persistent problems. Thirdly, children cannot communicate their problems as easily as adults do. Sometimes, a child's distress may manifest indirectly through disruptive behavior. Other times, adults mislabel a child's behavior as a psychological problem, when it is merely a normal developmental phase. At other times, adults will ignore children's problem behaviors, believing that the child will grow out of them when in fact the child really does need professional help. There are also differences among adults in how they perceive children's behavior. Finally, children's problems are often quite specific to particular situations or context. For example, a child might be physically aggressive at home, but not at school. Similarly, overactivity, which is a common complaint of teachers, depends on the circumstances. Table 1. Major clusters of childhood disorders. We have the diagnostics disorder, typical age of class, emotional disorders, developmental disorders, eating habits, disruptive behavior disorders. Reactive attachment disorders, birth to 5 years. Separation anxiety, preschool to 18 years. Phobias, varies according to type. Childhood depression, birth to 17 years. Developmental disorders. Artistic disorder, birth to 3 years. Rett disorder, birth to 4 years. Childhood disorder, disintegrative, 3 to 4 years. Asperger's disorder, preschool period. Mental retarded learning disorders, varies among subtypes. Eating habits. Bulimia nervosa, late at adolescence. Anorexia nervosa, 17 years. Elimination disorder, example, enuresis, birth to 5 years. Speech disorders, example, stuttering, 2 to 7 years. Tourette disorder, 2 to 18 years. Disruptive behavior disorders. Conduct oppositional defiant disorder, 5 to 16 years. And sometimes 0 to 8 years. Attention deficit hyperactive disorder, ADHD, elementary school age. Source, based on data from DSM-4. Summary. In this lecture, we have learned that all of the childhood disorders listed in DSM-4 involve behaviors in which a child deviates from what is expected of her at a particular age and cultural setting. These behaviors are persistent and severe. They interfere with the child's development and day-to-day function. There is a quantitative rather than a qualitative difference between normal and abnormal behaviors. Comorbidity means multiple diagnoses. Children's disorders can be divided into 4: emotional disorders, developmental disorders, eating and habit disorders, and disruptive behavior disorders. Assignments. Classify childhood disorders according to DSM-4 category. Post-test. 1. Childhood disorders interfere with the child's dash and dash. 2. Comorbidity means dash. 3. Frequent tantrums that occur in peculiar circumstances might be considered dash, abnormal or normal. Take the right response. 4. On the whole, children's problems can be divided into dash areas: A5, B2, C3, D6. End of study session 1. Thank you for listening.